is Kristen Campbell, and today I will be talking about the treatment of mental illnesses, particularly through drug use. So, medication or prescription drugs are the most common forms used to treat mental illnesses today. These drugs are prescribed based on a variety of factors, which include the type of mental disorder and the severity of the symptoms. Research on medication used to treat mental illnesses have been focused on on the biochemical aspect of things, meaning they have been focused on how the drugs affect nerve activity and brain function. Okay, so what do we know about psychotropic or psychoactive drugs? First and foremost, a psychoactive drug is any drug that alters the mind, the emotion, or behavior. From a biochemical standpoint, researchers don't know exactly how some of these drugs work, but the physical or observable effects that are associated with the use of these drugs are enough to have these drugs prescribed for certain mental disorders. Moving on to the classes of psychoactive drugs. There are four main classes of psychoactive drugs, which include stimulants, opioids, hallucinogens, and depressants. Stimulants are generally associated with an improving mood, increase in energy, and heightened alertness. Some of these drugs classified as stimulants include caffeine and nicotine. Opioids, on the other hand, are used for pain relief and are associated with feelings of euphoria, and examples include codeine and oxycodone. Hallucinogens are associated with hallucinations, paranoia, depersonalization, and examples of these drugs are psilocybin, LSD, and PCP, whereas depressants are used to reduce tension, provide anxiety relief, muscle relaxation, and examples include benzodiazepine and barbiturates. Okay, now we're going to look at some common uses of psychoactive drugs. Psychoactive drugs can be used as minor tranquilizers. We see where benzodiazepine and some propanedials have been used to treat anxiety. They can also be used as major tranquilizers. We see where phenothiazine has been used to treat schizophrenia, and they can also be used as antidepressants or anti-mania drugs, and these work in the treatment of bipolar and depressive disorders. Okay, now what are some common side effects of psychotropic drugs? The adverse of psychotropic drugs are usually adverse and of a very wide range. Symptoms include, some of these effects include endocrine and metabolic malfunctioning, sexual dysfunctions, thyroid problems, and an increased risk of obesity. And these are just a few of the many effects that are associated with psychoactive drugs. Okay, so since researchers don't know exactly how some of these drugs work, and they have such a wide range of side effects, how effective are these drugs exactly? While some of them may prevent abnormal behavior, do they actually do more harm than good? Now, this question has been risen by critics who have a problem with the use of medications used to treat mental disorders. For example, we see where clozapine improves motivation in schizophrenic and reduces apathy, but it has also been associated with blood abnormalities which have led to death and a weakening in the immune system. Valium is also another example. It helps with anxiety, but there is a high probability for dependence by its users. Okay, so this all ties into the fact that medication offers a treatment but not a cure for mental illnesses. What they really do is they alleviate these symptoms, not necessarily provide a cure. This has also been an important point that came across when I was doing my interviews. Participants were very skeptical as to whether or not medications really do work effectively to treat mental illnesses. And, this provides a very good explanation that they don't really cure them. What they do is provide a treatment by treating the symptoms. Okay, so since medications do not cure mental illnesses, what exactly does this mean? This means that there is a higher risk of overdose. In a study conducted in 2014, it was actually seen where mentally ill patients who were prescribed psychoactive drugs, about over 15,000 of them, ended up overdosing on these drugs. One possible explanation for this is because with these drugs, patients may develop tolerance, and therefore they would need more medication in order to feel the same effect from these drugs. This also means that there's a possibility for the repeat of abnormal behaviors. Since psychoactive drugs or medication does not necessarily cure the mental illnesses, technically they're still there. Okay, so while psychoactive drugs are not very effective at providing a cure for mental illnesses, it has been proven to work best, where it's most efficient when combined with other forms of therapy such as psychotherapy. Another thing is that every medication has its risk, whether it's medication used to treat mental illnesses or physical illnesses. They're all still medication and they all still have risk. So this concludes my presentation, and I hope you have a great day and please stay safe.